Question 1. During a complex orthopedic procedure, the surgeon requests a device that can spread and hold the wound open autonomously without the need for a surgical assistant's hands. Which of the following instruments should the sterile processing technician, SPT, ensure is provided in the set? A. Richardson retractor. B. Jelpy retractor. C. Army-Navy retractor. D. Sen retractor. Correct answer B. Knowledge point explanation. Core rationale. A Jelpy retractor is classified as a self-retaining retractor. It features a mechanical mechanism, such as a ratchet, that allows it to stay securely open on its own, freeing up the surgical team's hands during the procedure. Trap analysis. Option A is incorrect because a Richardson is a handheld retractor. It is only correct when an assistant is available to manually hold the tissue. Option C is incorrect as the Army-Navy is a handheld retractor used for shallow incisions. Option D is incorrect because the Sen is a delicate, handheld retractor used for superficial tissue retraction. Concept extension. Self-retaining retractors must be thoroughly inspected at the ratchet or spring mechanism to ensure they can withstand tension without collapsing during surgery. Question 2. What specific structural component of a ring-handled surgical instrument is designed to securely lock the handles in place and maintain tension during a procedure? A. Box lock. B. Shank. C. Ratchet. D. Jaw. Correct answer C. Knowledge point explanation. Core rationale. The ratchet is the interlocking mechanism located near the finger rings of a surgical instrument. It is designed to lock the instrument closed at varying degrees of tension, ensuring the jaws hold tissue or vessels securely without constant manual pressure. Trap analysis. Option A is incorrect because the box lock is the hinge joint where the two halves pivot, not the locking mechanism. It is correct when identifying the weakest point of the instrument. Option B is incorrect because the shank is the body segment providing length, correct when discussing the instrument's reach. Option D is incorrect because the jaw is the working end that contacts tissue, not the locking part. Concept extension. The ratchet must be tested by closing it on the first click and gently tapping the rings against a solid surface. If it springs open, it is defective and dangerous. Question 3. While inspecting and assembling an orthopedic instrument tray, a technician evaluates a heavy-duty instrument featuring a sharp, cup-shaped working end. The device is specifically engineered to bite away small chunks of bone and tough tissue. Which instrument is being processed? A. Osteotome. B. Rongeur. C. Tissue forceps. D. Chisel. Correct answer B. Knowledge point explanation. Core rationale. Rongeurs are robust surgical instruments specifically designed with cup-shaped jaws that take bites out of hard bone and tissue. They are essential for heavy-duty orthopedic and neurosurgical procedures. Trap analysis. Option A is incorrect because an osteotome is used to shave or cut bone with a mallet, not bite it. It is correct when a chisel-like slicing action is needed. Option C is incorrect because tissue forceps are used to grasp soft tissue, not cut or bite bone. Option D is incorrect because a chisel shapes bone using a mallet and has a beveled edge on only one side. Concept extension. Rongeurs can be single action or double action. Double action rongeurs provide greater biting force with less hand fatigue and must be tested using an index card for sharpness. Question 4. Which of the following represents the critical chemical process applied during instrument manufacturing that utilizes nitric acid to remove foreign iron particles and create a permanent, corrosion-resistant protective finish? A. Passivation. B. Forging. C. Tempering. D. Milling. Correct answer A. Knowledge point explanation. Core rationale. Passivation is a chemical treatment process, usually utilizing nitric acid, applied to stainless steel instruments during manufacturing. It removes iron particles from the surface and promotes the formation of a protective chromium oxide layer, which renders the instrument highly resistant to corrosion and rust. Trap analysis. Option B is incorrect because forging is the physical process of heating and shaping the raw metal, correct when discussing the initial structural formation. Option C is incorrect because tempering involves heat treating the metal to increase hardness, correct when discussing edge retention. Option D is incorrect because milling is the mechanical cutting and grinding of the instrument's features. Concept extension. The passivation layer can be easily destroyed by improper cleaning agents, like bleach or saline, or prohibited marking methods, like mechanical engraving. Question 5. A technician is sorting instruments that require a razor-sharp edge to cut tissue and shave bone. These specific instruments are manufactured from a high-carbon alloy that can be heat-hardened. Which exact material classification is being utilized for these cutting tools? A. 300 series austenitic stainless steel. B. 400 series martensitic stainless steel. C. Titanium alloy. D. Tungsten carbide. Correct answer B. Knowledge point explanation. Core rationale. 400 series stainless steel, also known as martensitic stainless steel, is characterized by its high carbon and low chromium content. This composition allows it to be heat-hardened, tempered, making it ideal for instruments that must maintain a sharp cutting edge, such as scissors and osteotomes. Trap analysis. Option A is incorrect because 300 series, austenitic, cannot be heat-hardened and does not hold a sharp edge. It is correct for retractors and basins. Option C is incorrect because titanium is used for lightweight, non-magnetic needs, not primary heat-hardened cutting bodies. Option D is incorrect because tungsten carbide is used as soldered inserts for extreme durability, not as the primary series steel for the entire instrument body. Concept extension. Because 400 series martensitic steel is high in carbon, it is magnetic and more susceptible to corrosion than 300 series steel if not strictly maintained and lubricated. Question 6. During an abdominal procedure, the surgeon encounters a dense layer of fascia and requests an instrument specifically designed to incise and dissect the tough tissue. Which category of surgical instrument should the sterile processing technician, SPT, ensure is available and properly sharpened? A. Scissors. B. Retractors. C. Forceps. D. Osteotomes. Correct answer A. Knowledge point explanation. Core rationale. Scissors are surgical instruments explicitly manufactured with sharp blades designed to cut, incise, or dissect soft tissue during surgical interventions. They must be rigorously tested for sharpness before assembly. Trap analysis. Option B is incorrect because retractors are used to hold back tissue and expose the surgical site, not to incise it. Option C is incorrect because forceps are designed to grasp and manipulate tissue. Option D is incorrect because osteotomes are utilized with a mallet to shave or cut hard bone, not soft tissue like fascia. Concept extension. High-quality surgical scissors are often forged from 400 series martensitic stainless steel, which can be heat-hardened to maintain a razor-sharp edge longer than softer alloys. Question 7. A surgical set returns to the decontamination area with severe pitting and localized corrosion on the stainless steel instruments. The technician suspects the instruments were improperly soaked for a prolonged period in a common operating room, or fluid. Which of the following solutions is the most likely culprit? A. Saline. B. Enzymatic detergent. C. Sterile water. D. Instrument milk. Correct answer A. Knowledge point explanation. Core rationale. Saline is an exceptionally corrosive fluid commonly found in the ore. If instruments are exposed to saline for prolonged periods, the chloride ions aggressively attack the protective passivation layer, resulting in irreversible pitting and rust. Trap analysis. Option B is incorrect because medical-grade enzymatic detergents are specifically formulated to safely break down bioburden without harming the metal. Option C is incorrect because sterile water does not contain the corrosive chloride ions found in saline and is safe for keeping instruments moist. Option D is incorrect because instrument milk is a water-soluble lubricant that protects the metal from friction and rust. Concept extension. To prevent damage, instruments should never be soaked in saline. Instead, they should be pre-treated with an enzymatic spray or kept moist with a towel dampened with sterile water. Question 8. Which of the following classifications of surgical instruments is primarily engineered to grasp and hold tissue or objects securely during a surgical intervention? A. Forceps. B. Scissors. C. Rongeurs. D. Chisels. Correct answer A. Knowledge point explanation. Core rationale. Forceps are fundamental surgical instruments designed specifically for grasping. They can feature ring handles with a locking ratchet for clamping vessels, or thumb handles, pickups, with teeth or serrations for manipulating soft tissue. Trap analysis. Option B is incorrect because scissors are strictly utilized for cutting or dissecting materials, not grasping. Option C is incorrect because rongeurs feature heavy cup-shaped jaws utilized to bite out chunks of bone. Option D is incorrect because chisels feature a beveled edge designed to shape or sculpt bone when struck with a mallet. Concept extension. Grasping instruments like tissue forceps must be inspected closely at the tips to ensure the teeth mesh perfectly without overlapping, which would cause unintended trauma to the patient's tissue. Question 9. While inspecting a hemostat in the preparation and packaging area, the technician carefully opens the instrument to scrutinize the hinge area where the two shank halves meet and pivot. This specific anatomical structure is notoriously difficult to clean and is known as the A. Box lock. B. Ratchet. C. Jaw. D. Finger ring. Correct answer A. Knowledge point explanation. Core rationale. The box lock is the central hinge point of a ring-handled instrument where the two shanks meet and pivot. Because of its tight mechanical tolerances, it is the most common hiding spot for bioburden and is highly susceptible to stress cracks. Trap analysis. Option B is incorrect because the ratchet is the interlocking mechanism near the rings that holds the instrument closed. Option C is incorrect because the jaw is the working tip that makes contact with the patient's tissue. Option D is incorrect because the finger ring is the loop at the proximal end where the surgeon inserts their fingers. Concept extension. Instruments must always be placed on a stringer in the open position to ensure steam can penetrate the critical box lock area during the sterilization cycle. Question 10. To significantly extend the working life of a needle holder and provide a superior grip on suture needles, the grasping inserts welded into the jaws are most frequently manufactured from which exceptionally hard metal? A. Tungsten carbide. B. Austenitic stainless steel. C. Titanium. D. Aluminum. Correct answer A. Knowledge point explanation. Core rationale. Tungsten carbide is an extremely hard, durable ceramic metal composite. When used as inserts in the jaws of needle holders, it prevents the needle from slipping and lasts significantly longer than standard stainless steel jaws. Trap analysis. Option B is incorrect because austenitic stainless steel, 300 series, is relatively soft, non-magnetic, and typically used for retractors or basins, not for high-friction grasping surfaces. Option C is incorrect because titanium is favored for its lightweight and non-magnetic properties, rather than for friction inserts on needle holders. Option D is incorrect because aluminum is far too soft and malleable to withstand the heavy mechanical stress of driving a surgical needle. Concept extension. Instruments featuring tungsten carbide inserts or cutting edges are universally identified by their gold-colored finger rings. Question 11. During the assembly of an orthopedic major set, the sterile processing technician, SPT, must verify the inclusion of a specific instrument designed to cut or shave bone. This solid stainless steel device is uniquely engineered to be struck by a surgical mallet during use. Which of the following instruments fits this exact description? A. Osteotome. B. Rongeur. C. Whiteliner retractor. D. Elevator. Correct answer A. Knowledge point explanation. Core rationale. An osteotome is a heavy-duty surgical instrument featuring a beveled edge on both sides of the cutting tip. It is utilized in orthopedic procedures to shave or slice through hard bone and must be driven by a heavy surgical mallet. Trap analysis. Option B is incorrect because a rongeur uses heavy, cup-shaped jaws to manually bite away bone chunks without the use of a mallet. Option C is incorrect because a whiteliner is a self-retaining retractor utilized to hold open shallow incisions, not cut bone. Option D is incorrect because an elevator is used to pry or lift tissue, like periosteum, away from the bone, not to cut it via mallet impacts. Concept extension. Osteotomes must be rigorously tested for sharpness by pressing the cutting edge against a plastic dowel rod. It must shave the plastic without slipping. Question 12. While inspecting bone cutting instruments at the workstation under a lighted magnifying lamp, a technician identifies a heavy device similar to an osteotome but featuring a beveled cutting edge on only one side of its tip. What is this specific mallet-driven instrument called? A. Osteotome. B. Chisel. C. Bone curette. D. Bone rasp. Correct answer B. Knowledge point explanation. Core rationale. A chisel is extremely similar to an osteotome as both are driven by a mallet to cut bone. However, the critical anatomical difference is that a chisel features a beveled edge on only one side, allowing the surgeon to sculpt the bone in a specific directional plane. Trap analysis. Option A is incorrect because an osteotome has a beveled edge on both sides of its cutting tip, tapering equally. Option C is incorrect because a bone curette is a spoon-shaped instrument used to manually scrape away soft bone or tissue without a mallet. Option D is incorrect because a bone rasp is used to file or smooth rough bone edges manually, not to cut them via mallet strikes. Concept extension. Just like osteotomes, chisels are forged from hard 400 series martensitic stainless steel to withstand the severe mechanical impact and retain their sharp, tempered edge. Question 13. Which specific class of surgical stainless steel is generally non-magnetic, cannot be heat-hardened, and is primarily utilized in the manufacturing of surgical basins, instrument trays, and retractors due to its superior corrosion resistance? A. 300 series austenitic stainless steel. B. 400 series martensitic stainless steel. C. Titanium alloy. D. Tungsten carbide. Correct answer A. Knowledge point explanation. Core rationale. The 300 series stainless steel, technically known as austenitic stainless steel, is high in chromium and low in carbon. This specific chemical composition makes it highly resistant to corrosion, non-magnetic, and relatively malleable, which is ideal for structural items like basins and retractors that do not require a sharp cutting edge. Trap analysis. Option B is incorrect because 400 series, martensitic, is magnetic, high in carbon, and heat-hardened specifically to hold sharp edges, e.g., scissors. Option C is incorrect because titanium is an entirely different metal distinct for its lightweight and blue anodized finish, not a series of stainless steel. Option D is incorrect because tungsten carbide is a ceramic metal composite used for hard jaw inserts, not the primary steel for basins or retractors. Concept extension. While generally non-magnetic, 300 series austenitic steel can become slightly magnetic after undergoing extensive machining during the manufacturing process, though significantly less so than the 400 series. Question 14. During an exploratory laparotomy, the surgical assistant is tasked with manually holding back the abdominal wall to expose the internal organs for the duration of the procedure. Which of the following instruments is classified as a handheld retractor and would be utilized for this specific task? A. Gelpi retractor. B. Balfour retractor. C. Whiteliner retractor. D. Richardson retractor. Correct answer D. Knowledge point explanation. Core rationale. The Richardson retractor is a common handheld retractor used extensively in abdominal and general surgeries. Unlike self-retaining models, it lacks a mechanical locking mechanism and requires continuous physical tension provided by a surgical assistant to keep the tissue retracted. Trap analysis. Option A is incorrect because the Gelpi is a self-retaining retractor that uses a ratcheted spring mechanism. Option B is incorrect because the Balfour is a heavy, self-retaining abdominal retractor that locks open automatically. Option C is incorrect because the Whitelawner is a self-retaining retractor with a ratchet mechanism used for shallow wound exposure. Concept extension. Because they do not feature moving hinges or ratchets, handheld retractors are generally easier to clean, but their smooth surfaces must still be thoroughly inspected for scratches or pitting that could harbor bioburden. Question 15. A sterile processing technician, SPT, is assembling a delicate tray dedicated to microscopic laser surgery. The technician notes that several specialized instruments feature a distinct matte black chromium finish. What is the primary clinical purpose of applying this specific dark surface coating to the instruments? A. To absorb light energy and prevent dangerous laser beam reflection. B. To indicate the instrument is manufactured from non-magnetic titanium. C. To provide a sharper cutting edge with less tissue trauma. D. To signify the instrument requires specialized low-temperature sterilization. Correct answer A. Knowledge point explanation. Core rationale. Instruments utilized in laser surgery are intentionally manufactured with an ebony or black chromium finish. This specialized dark coating absorbs light energy and strictly prevents the high-intensity laser beam from dangerously reflecting off the instrument and burning unintended tissues or injuring the surgical staff's eyes. Trap analysis. Option B is incorrect because titanium instruments are typically identified by a distinct blue anodized finish, not black chromium. Option C is incorrect because a sharper edge is indicated by the supercut design, which features black rings, not a full black coating. Option D is incorrect because the finish type does not dictate the sterilization modality. Laser instruments can often endure standard steam sterilization. Concept extension. The black finish must be carefully protected from physical impact during assembly. If the instruments are thrown loosely into a basket and the black coating scratches off, exposing the shiny metal underneath, the instrument becomes a dangerous reflection hazard and must be removed from service. Question 16. A sterile processing technician, SPT, is assigned to test the sharpness of various scissors in a major general surgery tray. They notice a pair of Mayo scissors with gold-colored finger rings. What does this specific handle color indicate regarding the instrument's cutting edge? A. The blades feature tungsten carbide inserts that will hold a sharp edge significantly longer than standard stainless steel. B. The instrument is manufactured entirely from 300 series austenitic steel and cannot be heat hardened. C. The blades are microgrind supercut scissors designed to slice tissue with minimal trauma. D. The scissors are designed exclusively for laser surgery and feature a non-reflective coating. Correct answer A. Knowledge point explanation. Core rationale. Tungsten carbide is an exceptionally hard ceramic metal composite. When integrated as inserts on scissor blades, it is universally identified by gold-colored handles and allows the instrument to maintain its sharpness for a significantly longer duration than standard stainless steel blades. Trap analysis. Option B is incorrect because scissors require a hardened edge, usually made from 400 series martensitic steel, not the softer 300 series. Option C is incorrect because supercut or microgrind scissors are universally identified by black-colored rings, not gold. Option D is incorrect because laser surgery instruments feature an overall black chromium or ebony finish to absorb light, not gold rings. Concept extension. Even with tungsten carbide edges, scissors must still be rigorously tested for sharpness using the appropriate thickness of latex testing material without snagging. Question 17. During the assembly of a plastic surgery set, the technician must distinguish between two visually similar thumb forceps. One instrument is intended to securely grasp the tough epidermal layer, while the other is meant to handle delicate wound packing without puncturing it. How should the technician correctly identify and separate these two devices? A. The tissue forceps will feature a box lock, while the dressing forceps will feature a ratcheted spring. B. The tissue forceps will have interlocking teeth at the tip, while the dressing forceps will feature horizontal serrations. C. The tissue forceps will have serrations, while the dressing forceps will have interlocking teeth. D. The tissue forceps will be marked with gold rings, while the dressing forceps will have black rings. Correct answer B. Knowledge point explanation. Core rationale. Tissue forceps and dressing forceps are differentiated by their working tips. Tissue forceps are equipped with teeth, like 1x2 teeth, to securely grasp and hold tough tissue without it slipping. Dressing forceps lack teeth and instead feature fine serrations to gently manipulate dressings or delicate tissues without puncturing them. Trap analysis. Option A is incorrect because thumb forceps do not have box locks or ratchets. Those are features of ring-handled instruments like hemostats. Option C is inverted. It incorrectly assigns serrations to tissue forceps and teeth to dressing forceps. Option D is incorrect because gold and black rings denote tungsten carbide and supercut features on scissors or needle holders, not the difference between tissue and dressing forceps. Concept extension. When inspecting tissue forceps, the technician must ensure that the teeth perfectly interlock when closed. Misaligned teeth will traumatize patient tissue rather than providing a secure grip. Question 18. A technician is performing quality assurance testing on a heavy, double-action instrument designed to bite bone. The technician prepares to test the sharpness of the cup-shaped jaws. Which testing material and method must the technician utilize to properly evaluate this specific device? A. Cutting through a single layer of yellow facial tissue to check for snagging. B. Slicing through a piece of red testing latex measuring at least 4.5 inches. C. Shaving a piece of a plastic dowel rod without the blade sliding over the surface. D. Biting into a standard index card to ensure it cuts a clean hole without tearing. Correct answer D. Knowledge point explanation. Core rationale. Rongeurs, including double-action models, are designed for the heavy-duty task of biting bone. Their sharpness should be evaluated by biting into an index card or cardstock. The jaws must punch a clean hole. If the paper tears, the jaws are dull or misaligned. Trap analysis. Option A is incorrect because facial tissue or yellow latex is used to test delicate, small scissors, less than 4.5 inches, not bone-biting instruments. Option B is incorrect because red latex is used to test larger scissors, not rongeurs. Option C is incorrect because shaving a plastic dowel rod is the specific test for osteotomes and chisels, which have a slicing rather than a biting action. Concept extension. Double-action rongeurs have two hinges, which mechanically multiply the force applied by the surgeon, reducing hand fatigue during procedures that require repeated bone removal. Question 19. Which of the following is considered an approved and preferred method for applying permanent identification markings to surgical instruments without creating microscopic crevices that harbor bacterial bioburden? A. Laser etching. B. Mechanical engraving using a vibrating tool. C. Stamping with a steel die. D. Carving with a scalpel blade. Correct answer A. Knowledge point explanation. Core rationale. Laser etching is an acceptable and preferred method for permanently marking instruments. It creates a smooth, durable mark that does not damage the passive layer or create deep scratches and crevices where bacteria can hide and rust can form. Trap analysis. Option B is incorrect because mechanical engraving physically scratches the stainless steel, destroying the protective chromium oxide layer and creating a permanent breeding ground for bioburden and corrosion. Options C and D are completely prohibited for the exact same reasons, as they physically damage the integrity of the instrument's surface. Concept extension. Other approved methods include chemical acid-base etching, if properly neutralized, and the application of specialized identification tape, which must only be wrapped 1 to 1.5 times around the shank. Question 20. Why is the use of common commercial dish soap strictly prohibited for the manual cleaning of surgical instruments in the decontamination area? A. It contains high levels of chloride ions that cause rapid pitting corrosion on 400 series stainless steel. B. It is highly acidic and will immediately strip the black chromium finish off laser instruments. C. It is not formulated to break down bioburden and can leave residues that interfere with the sterilization process. D. It is too expensive to use in the large volumes required for medical device processing. Correct answer C. Knowledge point explanation. Core rationale. Dish soaps are household cleaners that are not approved or validated for medical devices. They are not chemically formulated to safely and effectively remove human bioburden, blood, fat, protein, and often contain whiteners or fragrances that leave residues on the instruments, which can block sterilants and cause pyrogenic patient reactions. Trap analysis. Option A is incorrect because saline, not dish soap, is the primary source of corrosive chloride ions in the clinical setting. Option B is incorrect because dish soaps are generally neutral to alkaline, not highly acidic. However, they are still prohibited due to residues. Option D is incorrect because dish soap is actually very inexpensive, but cost is entirely irrelevant to its clinical unsuitability. Concept extension. Only medical-grade, validated detergents, such as enzymatic cleaners designed specifically for the soils encountered in surgery, should be utilized in the decontamination process.